All right, so today we're talking about the use of mobile clinics because they can be so helpful to those who don't always have access to quality health care nearby. Cone Health uses them all across the Triad, including right here in Greensboro. The Clinic on Wheels stopped at Freeman Mill Square. And that's where WFMY News 2's Sydney Moore met a man who says the mobile has greatly improved his health.
Our parks and recreation system is great.
Barry Jones enjoys living in Greensboro. It's where he's lived all his life.
But I actually live in the southeast part of town now.
As a native, he's watched the city evolve over the years in good and challenging ways, specifically where he resides near Freeman Mill Square.
When I was a kid, this was a very self-sufficient African-American community, but through revitalization, so to speak, that was taken away. We saw the mall come in, so that moved a lot of the businesses away from this community. And in places that drugs and violence came in.
He feels like the area became a desert for many things like food and access to health care.
I've noticed a lack, but I've noticed an effort to address it. But I think one of the problems is our community, we don't have health insurance.
Jones has chronic high blood pressure. At one point in his life, it was considered critical.
I did not have primary care. So therefore, if you don't have primary care, you can't get a 30-day prescription renewed time after time like you need to do with chronic disease.
In urgent need for care, he was referred to visit Cone Health's mobile clinic that was parked right near his home.
My lifesaver. When I came here, that was my goal, was to get a healthcare provider to write the prescriptions.
And he did just that.
So just need you to fill out the registration form.
Well, it's a walk-up only. They may need to have their blood pressure medication bridged until they get to see their doctor, or they may just have not seen anybody for their health care in several years.
Physician assistant Carrie Mayers helped assist Jones. She says scheduling to see a primary doctor can be difficult due to an influx of patients. Mobile clinics help alleviate that issue.
We do get to spend more time with a patient based on how many people are waiting to be seen.
I had heart exams through other providers that did not find what she found just with a stethoscope. So, you know, that really threw me for a loop right there, and it got the ball rolling on me trying to get into better health.
Thanks to a correct diagnosis, medication to manage the disease, and easy access,
I call this my public service announcement to my community.
Jones uses his voice to encourage others to take advantage of mobile clinics that help steer his health in the right direction. In Guilford County, Sydney Moore, WFMY News 2.
Well, Barry Jones, who you just saw the story about, is now on the road to having better health. Well, who can use the mobile medicine services? What all is offered there? To answer those questions and more is Dr. Olu Jegede. He's Vice President of Clinical Care, Health Equity for Cone Health. All right, so when we talk about this mobile medicine program, Doctor, what exactly are we talking about? What's available?
Good evening, and thank you for having me. So Cone Health the mobile medicine program is one of the ways Cone Health is keeping our brand promise of we are right here with you. So we take care to our people in the community through the mobile medicine program. Right now we have about 3 units. One is the mobile medicine, which is really clinic on wheels. And then we have the mobile screening van and the cancer screening, which is mobile mammography for breast cancer.
Okay, so let's kind of like go through each one of them because it's like a doctor's office that's on wheels. The specific services, starting with the Cone Health mobile medicine unit. What can you get done on that unit?
Oh yeah, thank you for asking. So the mobile medicine itself is like the clinic that you go to, like you go to your doctor's office. We provide all care, including acute care and chronic disease management. The acute care could be like flu, sore throat, or even common cold. And then the chronic disease are those high blood pressure, high blood sugar, cholesterol, asthma, or COPD. So you come to the clinic, you get checked like you will in your doctor's office.
Gotcha.
And we see patients from age 6 and above, and all ages, that is about 6 years, all the things that we screen them for, will they come and get care for the chronic disease that they have.
Okay, so that is kind of like your primary care kind of mobile unit kind of thing. Now you have a screening unit. So what's offered on that and who can be screened in for what?
Yeah, so the screening unit is really very important because our goal is to go upstream and make sure that people they know exactly what they may have. Um, for example, statistics let us know that people between the ages of 18 and 44 who have high blood pressure, 1 in 5 actually know they have high blood pressure. So we want to make sure that people are getting screened for high blood pressure, for blood pressure, blood sugar, making sure that we are connecting them to care and making sure that people are aware of even things to prevent. Say you have pre-diabetes, we want to make sure you don't get to the level of diabetes. So we can only do that by screening. And when we screen you, we'll tell you your result, we connect you to a primary care. And then from there, you get the care that you need. And this is also from everyone from 6 and above.
Gotcha. I can't imagine only 1 in 5 know that they actually have high blood pressure. So you got a lot of people out there walking around not knowing that they should be doing something with their health.
Exactly. And you know, blood pressure, when you have high blood pressure, there are usually no symptoms until complication has arrived. When I see patients in my clinic, it's very unfortunate that, you know, a lot of the time I'm seeing them for the first time after a life-changing event has happened, like stroke, like heart attack, like maybe now they're on their way to dialysis. We really don't want that to happen. So we want to screen everyone and point their attention to those chronic diseases that sneak into us in our 40s and 50s and may cause damage before we know it.
Okay. All right, we're going to take a quick break, but we're going to be coming back talking a little bit more about mobile medicine.